Welcome back, everybody. We shall continue with our next session that's titled Frameworks for Healthy Aging. One parallel session is happening right now in Hall A called Cellular, Systemic, and Lifestyle Mediators. I invite the session chair, Dr. Deepak Saini, who's the convener of Longevity India and professor at DBG here at IISA.
Thank you, everyone. And we're expecting some more delegates to come to the auditorium and become part of this proceedings. But it's a pleasure to ask the first speaker, Dr. T.V. Sekher, to actually give his opening, his talk. Dr. Sekher is a professor in the Department of Family and Generations at the International Institute of Population Study, IIPS. And he is also instrumental in running the LASI study, one of the most popular study which we use as reference study in India, and which is called the Longitudinal Ageing Study in India. And jointly with Howard Public School of Public Health and University of Southern California, USC, the study was funded by the Ministry of Health and Family Welfare. And there's a lot of things which we can learn from this study, and we are looking forward to hearing Dr. Sekher's talk about this session. Dr. Sekher.
Good morning to all of you. Thank you, Professor Saini and Professor Prabdeep Kaur for inviting me to talk about the LASI study, the Longitudinal Aging Study in India, and how it is done. And Professor Kaur also insisted me to say some findings of the study. The report is available in the public domain, the data is available in public domain, and we can see large number of people using the LASI data for research, policy making, and many other things. So let me start. What was the motivation for us to do the LASI study? As all of you know that India is experiencing a major demographic transition, aging transition, in a rapid aging transition all over the world, and India is no exception to that. 2011 census showed that around 9% of India's population are elderly or 60 plus, or what we call as senior citizens. That is approximately 100 million. But within the next 25 years, by 2050, the scenario is going to change drastically. That will be around 20% of India's population will be elderly. That means approximately 330 million elderly in our country. So the question is, as families, as society, as governments, we are prepared to face this rapid aging population, providing them care, medical care, social security, attention, emotional support, and everything. So keeping that in mind, so there were not many data available on the elderly population, which is nationally representative and state level representative. Most of our surveys like National Family Health Survey and many other well-known surveys were exclusively focusing on mothers, women in the reproductive ages 15 to 49 years and their children, various aspects of that. So keeping all that, and there is a premature burden of non-communicable diseases in our country. So all this, keeping that, we decided to have, with the government support, to develop and design a survey which is nationally representative, internationally comparable, and globally acceptable data. So LASI is India's first longitudinal aging study. We continue to do this survey for next 25 to 30 years. That is our plan. And in terms of sample size, this is the largest longitudinal aging survey in the world. Now, LASI is designed in tune with the similar surveys happening around 46 countries around the world. The most well-known is the Health and Retirement Study in US, English Longitudinal Aging Study, the SHARE in Europe, and also some of the aging studies like Chinese Aging Study, CHARLES, the Korean Aging Study, CLOSA, Japanese Aging Study, and LASI is the latest entrant to this elite club of health and retirement studies. And so most of our protocols, questionnaires, design, in comparison, synchronizing with the similar surveys around the world. So that will help us not only to compare across the country, across the countries and culture, but since India is so diverse in terms of its demographic and health characteristics, it is also help us to compare across states within India. So we at the International Institute for Population Science is mainly responsible for implementing the LASI study, which is mainly supported, the wave one was mainly supported by Ministry of Health and Family Welfare, Government of India, and also National Institute of Aging, NIH. And the wave 2 survey is fully supported by Ministry of Health and Family Welfare, Government of India. And we also had the international collaborators, Harvard School of Public Health and University of Southern California, and the regional geriatric centers, and the DBS samples, dried blood spot samples, were tested and stored at the ICMR Institute at Nari, Pune. So we have a wide-ranging collaboration with various specialized institutions for this study. So what are the important objectives of LASI? One is to understand, provide the health, not only the disease burden, but also the risk factors. It is not only the self-reported health, but also the measured health condition. We use a wide range of biomarkers to understand this. Healthcare and health financing. So on social side, family, social network, caregiving, elder abuse, discrimination happening at various levels. On the economic side, the income, the consumption, wealth, expenditure, retirement, workforce participation, many other things. And what are the welfare measures for elderly? How far elderly are aware about these welfare programs, and what is the extent of utilization, including the old age pension and other things. Now, health is a major component of LASI study. So we are able to provide the estimates at the national level and state level on communicable diseases and non-communicable diseases, and also on the burden of diseases, on self-reported and measured health conditions, and the risk factors for that, and the social determinants of communicable and non-communicable diseases, and the demography of aging transition, including the causes of death, life expectancy at older ages. We also have information on various healthcare utilization by elderly, their choice of healthcare providers, health expenditure, catastrophic health expenditure, medical cost on treatment, sources of healthcare financing, and health insurance coverage, and also the quality of care. So wide range of questions covered in the LASI survey. The questionnaire reports all are available on our website. It's also available on Ministry of Health website for you to refer. Now, LASI individual questionnaire covered a lot of questions, information about the health conditions of elderly or older adults. On the chronic diseases, communicable diseases, non-communicable diseases, mental health, that is one important component, including depression and many other things, functional health and helpers, healthcare utilization and health promotion activity, health behavior of older adults and elderly individuals, and many other things. So you can get information at the state level, national level on all these aspects from the LASI data and LASI. We also have a wide range of biomarkers. It is not only the self-reported health, but also the measured health condition. And we found big difference between the self-reported health by the respondents and when we actually measure for hypertension and diabetes. There is a big difference. Particularly in the rural areas, particularly among the poorest strata of society, good number of them are not even aware about they have hypertension or diabetes, because the elderly, particularly the poor among the elderly, never went for a medical checkup. So there is a big difference we observe between the self-reported health and measured health condition. So we have all these measurements, blood pressure, lung function test. Probably LASI may be the first study in India to do a population-based survey using the spirometry or lung function test to understand the health situation, health, vision test, near and distance. We also have anthropometric measurements like height, weight, waist and hip circumferences, and performance-based test, grip strength, timed walk, and balance test. We also collected the dried blood spot samples from our respondents. It is stored and tested at the ICMR Nari laboratory in Pune. It is still stored there. We can do more tests using that samples. Currently, we already tested for C-reactive protein, CRP, HbA1c, and HP. And on the family and social network side, we have the living arrangements, there are social participation, multi-generational family structure, which is very specific to Indian context, participation in their social activities, social organization, life satisfaction, the support received by elderly and support provided by elderly to other family members. And caregiving mechanism, good number of elderly are receiving care from their family members and others, but lot of elderly are also providing care to other family members, including their grandchildren. Information about their participation in social activities, lack of companionship, isolation, everyday discrimination, ill treatment or elder abuse, which happens both within the household, also outside the household. So overall satisfaction of elderly in their life and various aspects of life. So LASI provides information data on all of these things. On the economic front, we have data on their household income, expenditure, assets and debts, employment, retirement. Good number of elderly, even after 60 years, after 70 years, are still continue to work, not for the sake of working, but to support themselves and their family members. So we have all that information, the housing condition of older population, and to assess the poverty and food security among the older population. Now, the research designed in such a way that we are able to provide national level estimates and estimates for all states and union territories of India. So our sample consists of, from the selected households, we are interviewing the persons who are 45 years and above and their spouses irrespective of their age. So altogether, LASI Wave 1, we have a panel sample of 73,396 individuals, and we are going to follow them up in the next 25 years. Out of these 73,000 older adults who are 45 and above, nearly 32,000 are elderly individuals or 60 plus individuals or senior citizens. The first wave of LASI was carried out in 2017 and 18. Now we are about to launch, mostly by next month, the Wave 2 survey, going back to the same households and same individuals, interviewing them, taking their health measurement and find out what happened to them, what are their conditions, social, economic and health conditions, during what changes happened during the last 6 years. And we try to continue this survey on a longitudinal nature for the next 25 to 30 years. Now, LASI used 3 instruments basically. One is an household schedule. We are collecting all information about household. Any adult household member can be a respondent, or maybe 2 or 3 persons together can also give information. There is an individual schedule, which is 45 plus respondents, including all their biomarkers were collected, including the blood samples. Apart from these 2, unlike many other surveys, LASI have a third schedule called community schedule, or what we can call village schedule. Wherever the surveys were conducted, for example, in a village, we also canvassed a village schedule to collect all information about the village, the infrastructure, facilities, welfare programs. This will help us to analyze the data in a much better fashion. For example, if you want to know the healthcare seeking behavior of an elderly respondent, it varies considerably. Suppose the village in which he or she lives, there is a healthcare facility available within the village. The health seeking behavior will be totally different than the healthcare facility located 30 or 40 kilometers away from the village, particularly for the elderly. So we can compare the village characteristics, the community characteristics with the household and individual behavior. That is why LASI have this additional module, which is not seen in other surveys of the community schedule. Now, the LASI report was released in 2021 by then Health Minister Dr. Harshvardhan, and the LASI data was also released later. So we have the LASI India report available on our website. All of you can download. The LASI fact sheets, around 195 important indicators for all the states and national level, particularly older adults, 45 plus and elderly. It's all available separately. So easily you want to know what is the extent of old age pension coverage among the poor in Karnataka. You can look at the fact sheet and you will get the data. Or what is the extent of those who seek assistance for day-to-day activities or activities of daily living in a particular state. You can look at the fact sheets and get it. So all these fact sheets and data, everything is available on our website for you to download. Now let me Professor Kaur insisted me to present some of the findings. LASI report is quite big, more than 650 pages. I can see large number of publications have come out already. Most of the state governments are using it. Recently, the Nidhi Aayog set up a national commission under the chairmanship of Dr. V.K. Paul, member of the Nidhi Aayog, to, to have a strategy for elderly care in India. And LASI data is extensively used. Ministry of Social Justice and Empowerment is coming out with a new policy for national policy for senior citizens. We are providing all our data and evidences from LASI to that. Many state governments are using it. And of course, large number of research work coming out in top class journals using the LASI data is available now. Now let me give you, with the limited time, some of the findings for you. The prevalence of chronic conditions among the elderly as the age advances, there is a steady and consistent increase in the cardiovascular and lung disease. Of course, all diseases, but more pronounced in the case of cardiovascular and lung diseases. And this is a prevalence of chronic health conditions among elderly. This is the first time in India, based on a nationally representative survey, we are able to provide the prevalence of that. The cardiovascular diseases among elderly around 35%, hypertension 32% of the elderly, bone and joint disease 18%, diabetes 14%, any chronic lung disease 8%, heart disease 5% of elderly, stroke 2.7%, neurological and psychiatric problem 2.6%, high cholesterol 2.5%, cancer 0.7%. This is the first time we are able to provide a national level estimates on chronic diseases among the elderly based on a population-based survey. Now, if you look at the cardiovascular disease more specifically, which we include the hypertension, heart disease and stroke, overall the self-reported prevalence of diagnosed CVD is 35% of elderly in India. And the prevalence is increasing with age as expected and is more among the elderly women compared to elderly men. And 50% of elderly residing in urban areas were diagnosed with CVDs. Now coming to the treatment of hypertension, we have the data on what is the extent of hypertension adequately treated, hypertension controlled but not on treatment, undertreated hypertension or untreated hypertension. As you can see, 10% of elderly having hypertension are untreated. They are not taking any medication. Undertreated is around 35%, adequately treated is around 43%. And the untreated hypertension is almost 2 times higher in rural areas compared to the urban areas. The LASI data is available for rural, urban, across social groups, across different age groups, across gender. Now, the multimorbidity condition among elderly. It shows that a quarter of elderly have multimorbidities, around 23% compared to 13% among the older adults who are between 45 to 59 age groups. And you can see the no morbidity and single morbidity data as well. Now coming to the environment, that is a big concern about as age advances, the disability and many other issues emerges. 11% of elderly reported at least one form of impairment. It can be locomotor, mental, visual, hearing impairment compared to just 6% among the older adults who are in the 45 to 59 age groups. And the locomotor impairment is the leading impairment followed by visual impairment. And this is a national figure, but if you look at some of the states, there are significant number or percentage on this. Now coming to how many of the elderly are able to do the basic day-to-day routine activities, like having their own meals, getting up from the bed or having bath, changing the dress and all other things. So we have the activities of daily living. Our data shows 14% of elderly reported having 2 or more ADL limitations. So that means they need a help or care or assistance to take care of the basic routine activities which every individual need to do every day. And 37% of elderly reported having 2 or more IADL limited, instrumental activities of daily living, going out and meeting a doctor or purchasing going to the store and purchasing item, all those things. So that is 37% among elderly, but 14% have the basic limitations for carrying out the basic routine activities. Now coming to the mental health. I think in Indian context, the mental health is grossly neglected area, particularly among the elderly. There are not many geriatrician, mental health experts, and we using some internationally comparable scales, we try to understand the probable major depression among elderly. We found that 8% of elderly in India are suffering from depression. It is more among women compared to men, and more in rural areas compared to urban areas. And this is based on our scale using CIDF SF, which is an internationally accepted standard scale. Now, I will just take one more minute, and the hypertension, as I was mentioning to you earlier, there is a big difference between self-reported and measured hypertension. We asked all our respondents whether you have been diagnosed with hypertension. So, nearly 32% of them said, yes, we have this problem. But when we measured them on the spot using the Omron machine, we found it is 36%. That means there is a 4% difference. These are the individuals who are not aware about they have an hypertension. They never went for a medical checkup, or mostly they are coming from the lowest strata of society in the remote areas of India. Similar is the case with the diabetes. So what we get in most of the surveys, the self-reported health is not giving us an actual picture of the real burden of disease in our country. So that is one thing we need to take care of that. And when we asked this question in 2017 and 18, only 18% of elder individuals in India had any form of health insurance coverage. I think in the recent years, this has improved considerably. And recently, Government of India has come out with a scheme called Ayushman Bharat, which they say that all the elderly persons who are 70 years and above will be covered under Ayushman Bharat, irrespective of income status. That is going to be a major development in terms of providing health care to the elderly, particularly among the poor among the elderly. Now we are about to start the Wave 2 survey. We are all ready. Mostly the survey will be rolled out in next 1 month, which will be fully funded by the Ministry of Health, Government of India. We are going back to the same households and same individuals we surveyed in Wave 1 and going to collect the information from them, plus the new age-eligible individuals in those households. Those who are earlier 40, now they are 45 or 46 or 47. We will be covering that also. Maybe some respondents who are living away, they have come back to their household now. We will be interviewing them. We will be using the same interview schedules and biomarkers for comparison purpose. We will be canvassing those. But additionally, we are adding one more module in Wave 2 survey. That is to understand how the COVID-19 affected the elderly in India, their social life, their economic condition, health conditions. So there are additional questions on COVID-19 to find out its impact on elderly individuals. That is an addition in Wave 2 survey. Otherwise, we are using the same biomarkers, same questions in Wave 2 as well. Now, the last few years, LASI has played an important role in providing scientific data for research and policy making. And you can see its impact in various documents, including the documents of Niti Aayog, Planning Commission, and many of them. LASI also provides a lot of information on Government of India's Health Ministry's National Program for Health Care of Elderly. That is an important program. LASI data provides that. Particularly the various programs of the Ministry of Social Justice and Empowerment, Ministry of Rural Development on social security and pension policies. LASI also helped in developing a comprehensive national health policy framework for elder persons. And as I mentioned earlier, the new national policy for senior citizens, which will be announced by Ministry of Social Justice and Empowerment very shortly, within 1 or 2 months, has got all the data and information from the LASI to come out with their policy recommendation for, or blueprint for the next 20, 30 years. And as you can see in all top-class journals, scientific journals, large number of publications are come out. And we are hopeful that once we complete the Wave 2 survey, we hope to complete it and come out with the results and data by December this year. We will have much more big data for comparison, and we are hopeful that it will provide us more meaningful, more useful data for researchers and policymakers in India. So we have the LASI India report. Those who are interested, please download from our website. LASI fact sheets are available for all the states at national level. LASI data is available free of cost. You have to just fill up this form and send to our IIPS. You will get the LASI data within 3 to 4 working days. And if you have any questions, any clarifications on LASI data, you can always write to us and we'll be happy to provide that. Thank you very much.
And I think we can ask questions if audience have any. While the mic reaches the lady in black here, I have a quick question for you, Dr. Sekher. Please have the water first.
Yeah, please, please.
So one thing in the question, I said in the next wave, you are incorporating COVID-related questionnaire. I was just curious because last 2 days we have heard a lot of discussion about digital platforms being incorporated in healthcare schemes where people are talking about apps and access to apps and everything. Would it be beneficial to add a section on whether they use digital tools to manage their health, or has a digitization, which is because that is something which has changed in the last wave, which was done, has changed their health trajectories. Yeah. Getting some information will be very relevant because that will also decide what the next wave should look like.
Yeah, I think this was thoroughly discussed in our internal meetings. We added a few questions on that. For example, in the COVID question, we asked the respondent, do you use the Arogya Setu app during that time? And how frequently you interact with the family members using any of these digital platforms. We added a few questions, but I think there is scope for adding more questions. I was comparing with the Chinese aging study. Right. They have more questions than us, but we will be debating on that. Maybe in the wave 3, we'll be having more questions. But of course, we added a few more questions compared to wave 1.
Sure, thank you.
Thank you.
Yes.
Yeah, hello.
So, hello everyone. My question is, firstly, I would like to make a note that this is one of the very, very few studies that have focused on mental health, right? As we have observed from past 2 days. And apart from depression, which was there as a part of the study. So, did you find any other findings based on cognitive impairment, dementia, or Alzheimer's and anxiety disorders?
Okay. There is a LASI affiliated study called LASI Dementia Study. I'm not going to tell you the results of that. It's already available. It is a subsample of LASI. Around 4,000 individuals who were interviewed in LASI. They were taken for additional medical examination and questions. LASI Dementia Study. It is mainly carried out by All India Institute of Medical Science and University of Southern California together. Their results are available and they have estimated the extent of dementia in India and the various other issues related to that. So many of their publications are already available in Lancet and many other journals. So I would request you to look at that.
Any other questions?
Yeah.
Please keep your questions short so we have more questions.
Yeah, sure. Thank you so much, sir. After 2011, this is the very important data that we have to refer. So the question is, the abuse, elder abuse is one of the main problem that in India that we are facing. Of course, it is across the globe. How did you get the data about elder abuse? How come the elderly are open to you? How difficult was it to get the data from them?
I think it's a good question. We also had a lot of debate and discussion on this because in a big national level survey, a very sensitive issue like elder abuse happening within the household, asking the elderly respondent, it's quite a difficult thing. In many cases, they are not ready to reveal that one. I personally believe the data what we got on elder ill treatment or elder abuse is much underreported. But nevertheless, it provides us some picture. We found that 1 out of 20 elderly in India are abused either physically, emotionally, or financially, or verbally, or many other forms of abuse, or even neglected by their own family members. The sad part is that the persons who are supposed to take care of elderly, they are engaged in abusing and ill-treating the elderly. So in many cases, the elderly respondents are not able to reveal those things, but we try to meet them personally. Our team will spend 5 days in a particular location, 6-member survey team, and they have to only interview 25 households in 5 days. So they have enough time, they can meet them on the first day, complete the household survey, household questionnaire, meet the respondent second day, third day, fourth day, or fifth day. And during that course of time, they have tried to meet them privately without any disturbance from other family members. It is quite difficult in Indian household setup. But they tried their level best, 5 days, intensive field work locating those areas and collected the data. But I agree with that. These questions related to elder abuse and elder ill treatment, maybe most of the members or most of the elderly are reluctant to talk in case they are worried that if they reveal the fact, that may create more problem for them because they are complaining against their son or daughter-in-law or other family members, and they are continue to live in that household. It is a quite a very sensitive issue.
We have just a very, very short question.
Yes.
Just count till 5 if you can finish it.
Yes. Hi, this is Pooja, and very great study. I believe so 10 years back, and I'm looking for the wave 2 result. Just quick question. We've discussed this in the past. I'll talk to you offline. But are any other markers you're considering to add additional to what you have as part of wave 2? And I mean maybe other omics data or anything. Has that discussion
up.
progressed?
Yeah, I think we had a discussion with the Health Secretary 2 months back. As of now, we are continuing the 3 mark. We are done in the wave 1. But the wave 1 samples and the wave 2 samples will be with us. It is stored at the ICMR Nari lab in Pune. We can always do additional tests. So Ministry of Health is considering some additional markers, including cholesterol and many other issues. So as and when the funding is available and the approval is, and including the ethical approvals, we can always take up that study. That is why the blood samples are stored there and it is available there. So we will be considering all those things.
Thank you, Dr.
Including the genomic testing and many other things.
Thank you, Dr. Sekher. Thank you very much. I think we can keep continuing discussion with Dr. Sekher during lunchtime. I bet a lot of people have brilliant questions. So please find him on the lunch and keep asking your questions to him. Thank you.
Thank you. Thank you.